Hello and welcome to Prairie Pulse. Coming up a little bit later in the show, we'll hear from Scott Prebys and friends as they play us some jazz music. But first, joining me now is Dr. Avish Nagpal, an infectious disease specialist from Sanford in Fargo. Dr. Nagpal, thanks for joining us today.
Thanks for inviting me.
As we get started, 2020's been an interesting year to say the least. But before we get started with, I guess, COVID and what's going on there, tell us a little bit about yourself and your background, please.
Sure. I'm one of the infectious disease physicians at Sanford, and I've been with Sanford for about 7 years now in my current role. Additionally, I'm a medical director for infection prevention and control. And before I joined Sanford, I trained here when it was Meritcare. I was a resident here in internal medicine program from 2007 to 2010, and then I was down in Rochester doing my fellowship in infectious disease from 2010 to 2013, and then I came back and have been here since.
Okay, so you've been working in this arena for a little while, and this is the third time we've had you on, of course, Prairie Pulse since spring of 2020 for obvious reasons, I think, and we appreciate your time and your expertise here. But the big news is the potential vaccine front. It's already been people vaccinated in Britain, and the FDA is ready to approve it in the United States any day now, we hope and we think. But can you talk about the clinical trials and sort of the process that's been going on in that arena?
Yeah, big and great news. Very encouraging results from the clinical trials. We have now 3 vaccines which have made the results available publicly now, and all of them looks like they are pretty good vaccines. And the first one, which I expect to be approved, would be the vaccine from Pfizer, CDC is actually, FDA is actually going to meet immediately, and I completely anticipate that, fully anticipate that they will issue an emergency use authorization to the vaccine, and following that, we'll have the immunization committee meet and outline the recommendations, and I expect the vaccine to become available as early as next week.
Well, and what companies, you mentioned Pfizer, what other companies are involved with vaccines?
So the Pfizer is the one that will be, that I expect to be approved the first here in the United States, and then Moderna is ready with their data, and I expect that review and approval very soon. And then AstraZeneca is the third company that, that has released the results. And all of these results look very encouraging, and I suspect that at some point of time that vaccine will be approved too. And then there are other vaccines like Johnson & Johnson is manufacturing one, and then of course we have the Sinopharm vaccine from China, and the Sputnik V vaccine from Russia, which have also completed advanced trials, and UAE reviewed some preliminary results from the Chinese vaccine, and those appear to be pretty good too. So it looks like we'll have a number of options where we'll be able to use a number of different vaccinations with very high efficacy and very good safety profile over the next few coming months.
Yeah, so who gets the vaccine first, and how is that determined?
Yeah, so, every time we give the vaccine or recommend vaccine to somebody, we have to identify who's at the highest risk of getting a particular disease. For example, some vaccines are administered early in childhood, and some vaccines are administered to more elderly population because of their risk profile. And then we have some vaccines which are recommended to specific populations based on their risk of any particular infection. So as far as COVID-19 is concerned, we see that most of the severe disease and critical disease happens in people with underlying medical comorbidities or people who are elderly, so those are the ones who will be in the front of the line to get the vaccine, the priority group, so to say. And the second priority group would be the healthcare workers who are in the front line and seeing the patients who are having an active disease and are at the highest risk of transmitting the disease. So those two groups, the elderly population, healthcare workers, and people with underlying medical comorbidities, which place people at higher risk of severe COVID-19 disease, would be the first few groups to receive the vaccine.
Do you know, or is each state deciding who's going to get it first? I mean, who is making that decision? A governor, a doctor?
Yeah. So, FDA reviews and approves the vaccine, or in this case, emergency use of the vaccine. And then there's CDC and the immunization committee that recommends who should get the vaccine as a priority, and then it's distributed through the state, and the states, I think, are able to decide who they will prioritize in their part of the jurisdiction, so to say. So it's a multi-level decision, and then of course states distribute to individual healthcare systems or nursing homes, and then if they need to triage further, they are able to triage further. For example, if I'm getting 500 vaccines from the state ultimately to give to my employees at Sanford, and of course we have more than 500 employees at Sanford, and if I have to decide who gets the vaccine first till the next batch becomes available, I'll see who's working in the COVID unit, COVID-19 unit, and who's working at the front line in the ER and emergency room and walk-in clinic, and select the healthcare professionals who have underlying comorbidities or are elderly. Give them the vaccine first, and then as more and more vaccine becomes available, continue to expand it so that everybody can get the vaccine.
Yeah. What if somebody's recently had COVID? Do they need to get the vaccine right away?
So that's a very good question. It's an evolving question. I don't know the answer to that, honestly. There are cases of reinfection after COVID-19 infection. For whatever it's worth, those are rare at this point in time. So we do think that having an infection with COVID-19 kind of gives you some kind of protection. We don't know how long it lasts. So if somebody has had COVID-19 infection recently, and we have to triage who gets the vaccine, it may be reasonable to give it to people who have not had COVID-19 yet, and people who have had the COVID-19 infection can probably just wait a few weeks till we get more shipments of the vaccine, and then they can get it too. The trials did enroll people who had COVID-19 already, so looks like the efficacy is same.
Mm-hmm. What is Sanford doing, I guess, to prepare for the first wave of vaccines? I mean, and you have to keep it at a low temperature, at least the ones I've heard about.
Yes. So this is a mRNA vaccine, and mRNA is a molecule that's very sensitive to temperature. So we have to maintain a so-called cold chain, and it's a demanding cold chain. The Pfizer vaccine needs to be stored at minus 70 degrees. So we have made special efforts to get our freezer, a special freezer, and placed it in different places so we can maintain the cold chain. And then we have also been working to see who gets the vaccine first and how to prioritize people. So we have put in a lot of effort, and then we are also reviewing data as it becomes publicly available to make sure that what we are recommending is safe and it's efficacious.
Mm-hmm. COVID numbers in North Dakota seem to be dropping. Is that because of the governor's mask mandate recently, or other things? Can you comment on that?
Yeah, so that's very encouraging to see. We have had a couple weeks now, maybe a little over a couple weeks, where we have seen numbers dropping. So that's very encouraging, but I won't declare victory yet. I think we'll see another wave because we still have to see the effect of Thanksgiving travel, and then with Christmas holidays coming up, I expect the numbers to increase a little bit more. Hopefully, it won't peak as much as it did this last time around. But yeah, ever since the mask mandate went into effect, we have seen the numbers go down, and maybe a natural cycle has something to do with it, as it, all infections go through waves and troughs. So it's probably a combination of a number of factors, and public perception has increased quite a bit. Public perception of the risk, that is, we got a lot of media attention, unfortunately, with our, healthcare workers feeling overburdened, hospitals at capacity, and that kind of was a reality check for all of us in the community. And I think people have stood up and taken up some more responsibility with masking, social distancing. So people have made personal sacrifices. So I think it's time to thank the community too, along with the governor for issuing the mask mandate. So So I think this is a multifactorial thing that we are looking at with the decreasing case numbers. Let's not take it for granted. Vaccine is around the corner. Hopefully in the next few months we will get a good majority of the population immunized, and then we can start thinking about going back to some semblance of normal life here. So, but it's not the time to let the guard down. We have done a very good job. Let's not undo it.
Well, you say that. So, what's still important, I guess, to prevent the spread? I mean, is it wearing a mask, social distancing? So, what is the most important thing?
So, a combination of all. So, we call this a bundle of interventions, and this is not a new concept in medicine. We know that for every result that you want to see, and not just in medicine, in life, for every result that you want to achieve, you have to put in a number of efforts and intervention to make sure that it happens. Masking, of course, for source control, for your own good as well, and then social distancing and vaccinating the high-risk population first, and then ultimately expanding the vaccination as it becomes available to a good chunk of the population, so we can reduce the transmission as much as possible.
Mm-hmm. Well, we've heard that former Presidents Clinton, Bush, and Obama appear willing to get the vaccine almost immediately, and maybe even on live TV. Is that something that could be potentially valuable to asking people to get the vaccine?
Oh yeah, absolutely. So I think we are in desperate need for some kind of unity. We are unfortunately going through very divisive times, and if our leaders from both the parties come together and display confidence and trust in the vaccine publicly on TV, I think that helps a lot. Symbolism is important.
Well, I've heard reports that about 60% of the people will get it. But of course, that means 40% of the people may not get it. Why is there still maybe so much disinformation out there or concern about it? Is it political, conspiracy theories, or what?
It's a little bit more complicated than that. I think vaccines or any medication you give to anybody is kind of an intervention that you do. And of course, whenever you do an intervention, it's perceived as something artificial, perceived as something unnatural. So it's human tendency to raise questions about it. And vaccines, because there are so many government agencies involved in regulating the vaccine, because we want to make sure that it's safe and efficacious. Whenever government agencies are involved, there is always a question about government intervention. So it raises more questions. So these questions are natural, expected, and we have been addressing these. That's why we want the vaccine data to be publicly available. That's why we want the vaccines to be highly regulated. We have nothing to hide. We understand that new things or new interventions make people kind of scared or uncomfortable, and my responsibility here, and not just mine, the medical profession in general, our responsibility is to make the data and what we know as publicly transparent as possible. So trust in vaccines is very important to us, and that's why this data is being made publicly. That's why the entire operation is, we have gone to great lengths to make it transparent, and now we have seen that the companies themselves are stepping up and releasing information directly to public even before they make it available to FDA, or it goes through the normal peer review process in the scientific journals, and looks like there are no serious side effects from the vaccine. Most of the side effects we see are mild, like pain in the arm where you get the shot, maybe a little bit of fatigue after that. When Pfizer released its initial data, it looks like that they enrolled 44,000 people in their trial. Half of them received a vaccine, half of them received placebo, and there were initially, so far, for the couple months, 3 months that we have the data for, there were about 170 cases of COVID-19 in those people, 162 in the placebo group. and only 8 in the vaccine group. That's a huge difference. Even with the low numbers, I understand 170 is not a great number, but we enrolled 44,000 people, and we will get more data as time lapses and as time passes, and companies will continue to gather data to look at the long-term results of the efficacy. But that difference is astounding, and it's great news. I mean, if you had told me in March that we will have a vaccine by the end of the year, I would have just laughed. This has never happened. This is a very great moment. This is an achievement which we didn't even dream of till early this year. This is whatever hardship we have gone through as individuals, as society. This has been actually a banner year for vaccine research.
Okay, but so where and what are still the big spreaders? I mean, of course, I can say people in bars without masks, in restaurants, and at funerals, at weddings. But the common thread there is where people gather.
Yes.
So can you talk more about where are the potential for spreading this disease?
You listed all of them: indoors and closed spaces and large gatherings, and that's why we were really out there trying to convince people not to have large gatherings at Thanksgiving, and we will say the same about Christmas holidays. So I know it's individual sacrifice. I know it's hard. I know for most people this is the only time when they get to see their families. I think it's still reasonable for college kids to come home. I think it's still reasonable to have small gatherings. What we don't want is a situation where you have more than 15 people, more than 20 people, or as you see in weddings and funerals where there are more than 100 people or 200 people, or in bars and restaurants when they're dining indoors. It's impossible to keep your mask on and dine at the same time, and this virus does circulate in the air. So closed, small indoor spaces with large gatherings lead to super spreader events, which drive most of the transmission and the peaks of the pandemic.
Do you worry that even with a vaccine, the people that won't get it, or they'll be suspicious, or simply even maybe too terrified to leave their home, even if the vaccine is effective?
So, our goal here is to make sure that people have the trust in vaccine. We have the responsibility to address misinformation. So I'm kind of hoping that, most people are actually not vaccine deniers, so to say, or most people do not oppose the vaccine. Many people who want to get the vaccine, and some people who are not sure, are actually sitting on the fence waiting for the right information and some reassurance, which we are able to provide now based on results from really large trials that the vaccine pharmaceutical companies have conducted. So I think most people will eventually get convinced by the data and turn around and agree to get vaccinated. And on top of that, as we increase the number of people who we immunize, the transmission, if they don't get the infection, the transmission rates drop too. And then there's about a chunk of population which has already gotten COVID-19, and now people are getting used to you're wearing masks in public, being a little bit proactive in how they go out in public and how they protect themselves and their children and their parents. So I think between all these interventions, we will slowly move towards more of normalcy as we go deeper into 2021.
Can you talk briefly, we're almost out of time, about the enormous work and the sacrifices our frontline providers in hospitals and clinics have gone through?
Hats off to them. Hats off to them. It has been really difficult year for all the healthcare workers. They have been handling this since March, and as you mentioned already earlier in the interview, there have been a lot of divisions and a lot of resistance and a lot of denials and misinformation. So, and these healthcare workers, they have, as healthcare workers, they are used to seeing people die, but this has been something unreal. The scale of death and hospitalization or complications that we have seen is beyond anything that we have seen before. And this is in the setting of them realizing how dangerous this disease is, and they have been obviously doing the right thing by isolating, not having large gatherings. So they have lost the social support that they rely on to get through in hard times. So not only have they been struggling at work, they have been struggling with lack of social support. And in addition, especially my female colleagues, they have taken a lot of responsibility for their kids' education as well. So it has been very exhausting for our healthcare workers. It is not uncommon to see them breaking down at the end of the shift, or every week I see somebody who's having a hard time with it. But hats off to them. They have shown up for work every day, regardless of how their own personal feelings are, and they have continued to do what our community needs them to do.
Well, we are out of time. So if people want more information, where can they go?
Of course, CDC has up-to-date information. Our State Department of Health website has up-to-date information. Then immunization community, which immunize.org, that has some very good vaccine information about the vaccine. So between these three websites, you should be able to get most of the information.
Thanks for joining us today.
Absolutely, my pleasure.
Stay tuned for more. Scott Prebys and his jazz friends are based in the Bismarck area, and they specialize in improvisational American jazz. Enjoy a performance from the series Prairie Musicians. Well, that's all we have on Prairie Post this week. As always, thanks for watching.
Funded by the North Dakota Council on the Arts and by the members of Prairie Public.